You may not be aware of this, but many of the medicines we rely on, ones we take on a daily basis to make us healthier and to feel good, will predominantly test in men. Common drugs that we use for, say, a good night's rest, or ones that we have been trusting every day, like aspirin, were primarily studied and developed on men. But here's the problem. Our bodies, as women and as men, differ down to every single cell. And this includes how we process medications. This fundamental biological difference presents a challenge, but also an opportunity to provide safer drugs and appropriate dosing. Unfortunately, due to historical exclusion of women from research, we face higher risks of experiencing side effects when taking any medication. And these risks further increase when we take multiple medications at a time. I'm an emergency care doctor, and I see on a regular basis how these side effects and consequences can not only be troublesome, but actually dangerous and even deadly. I've dedicated my life's work to try to fix this situation from inside the medical system. But equally, and maybe even more importantly, is empowering women to understand how to advocate for ourselves effectively. My name is Dr. Alyson McGregor, an emergency care doctor and the author of the book Sex Matters, as well as the book Why Women Aren't Winning at Health But Can. Today, I've created a session for you called Why Medicine Affects Women Differently, and then what you can do about it. And during this eye-opening session, I'll delve into the reasons behind the male model becoming the framework for medical research. And by understanding this historical context, we can comprehend why women have been left at a disadvantage when it comes to receiving appropriate care for our bodies. However, this session is not solely highlighting the problem. It's about empowering each and every one of us to take control of our health and advocate for ourselves or for the women we love. I will equip you with the knowledge needed to navigate the healthcare system effectively, and together we will learn the essential questions to ask our doctors, ensuring that we receive the right care tailored to our unique bodies. This is not only a subject of importance to women, it's relevant to anyone who wants to see women thrive. Let's create a future where women receive the care that they deserve, where their health is prioritized, and where we all play an active role in championing our well-being. My name is Alyson McGregor. I am an emergency medicine physician, as well as an associate dean of clinical faculty affairs and development right now at the University of South Carolina School of Medicine, Greenville. I have been in the world of sex and gender differences for about 15 years now, both researching what differences are important to know when you go to the emergency department, also as an advocate for this type of information to be integrated throughout our medical system. It has been a long time where we have used men as our male standard for health and disease, our standard for research studies and our understanding of medications, dosing, and side effects. After researching the differences between men and women and realizing that we don't really know that much about women's unique health and wellness, I started to research this and published a lot with a lot of my collaborators around the country. But then I would go to my clinical shift in the emergency room, and I would see patient after patient and woman after woman not knowing this information, not knowing the information that she could use to tailor her health and her responses to the healthcare system. For instance, many medications that are prescribed to women are based on studies that were approved on men. And then they'll come into the emergency department, they'll complain of different side effects or how it's not working. And then I actually empower them to understand that it's different for them depending on where they are in their menstrual cycle, where they are with other medications interacting with it. And so I think it's a critically important piece of information for women to know. The reason why I wanted to do this session is because it's critical for women to know this knowledge. Let's think about this in terms of our evidence, our science. And so what happened was, in the beginning, several decades ago, we really understood scientific methods. We understood how to create evidence, and we had the whole process down. The problem is that we really focused on men. We enrolled men into clinical trials for these medications. We tested these medications in men. We actually even studied these medications in male animals, all throughout the system. And that was done in a sort of paternalistic way because we wanted to protect women. What if women would become pregnant during the study and we weren't sure if there would be a concerning effect, which is a real concern. However, there became this overall sense that women should not be studied in clinical trials, and even down to the animals, the sex of the animals. So that was just the way things were done. But what happens is women are the ones that are more likely to seek healthcare. They go to the doctors more. And when you go to the doctor more, you get prescribed medications. So women are much more likely to be on multiple medications that were never really studied in them. So we're really left with post-market surveillance reports, right? So you go through a decade and $1 billion of having a medication, you have FDA approval, then letting your doctor know that it's available to be prescribed, and then it's prescribed to you, women. And that's when we start to experience side effects and interactions with other medications that we weren't expecting because we didn't study it. So it's really critical for you to realize that what you are experiencing with medications is real. And it's important for you to make sure that you log this information, you discuss it with your physician, and you can alter perhaps dosing, perhaps the formulation, perhaps understanding how it changes its effect during your menstrual cycle. Because we didn't study these medications in women, the understanding of what the menstrual cycle does in the pharmacokinetics and the pharmacodynamics of medication breakdown is really left to chance. Our cycling of estrogen really affects all of those processes. We have receptors for estrogen in our brain, in our heart, in our liver, in our stomach. And all of these things actually affect our bioavailability of our medications, affects the safety, affects the whole therapeutic profile. So if you're cycling through, you may realize that during certain times of your cycle, your medication might be more effective or less effective, or you may have more side effects or less side effects. And so really taking charge of understanding that this is not in your head, that you're not making this up, and to really take good logs about this and discuss this with your prescriber will give you some really empowerment to tailor your medications to how they respond to you. When you take a pill, from the moment you ingest it, it has differences whether you are a male or female. The first thing that happens is something called pharmacokinetics, which is what your body does to the pill, how it moves the medication throughout your system. And then there's pharmacodynamics, which is what that pill does to your body. Now, if we look at pharmacokinetics, there are 4 main categories. The first is absorption. So you take a pill or a capsule or a liquid, and if that's the mechanism and you swallow it and it goes through your stomach and your intestines, you have to absorb that medication to your bloodstream. And then there's distribution, which is where does that medication go? Once you've absorbed it and it's in the bloodstream, it then gets distributed throughout your body to its target organ. And then the third condition is metabolism. So once that medication is distributed throughout, your body starts to break it down. and metabolize it. There are enzymes in your stomach lining, in your saliva, in your liver that start breaking down that medication as soon as you ingest it. And every medication has a lifespan. So once that pill gets absorbed, it's distributed, it's metabolized, and it's eliminated. If you think about that could occur in 30 minutes, that could occur in 6 to 8 hours, that could occur in 12 to 24 hours. So each medication has a lifespan in your body. And the fourth component is elimination. So once that medication has been metabolized and it's been broken down by enzymes, your body starts to eliminate it. It eliminates it mostly through your kidneys, and you excrete it through your urine. It's also eliminated through your GI tract or your sweat or your skin. Keep in mind that there are other ways that you can take medications. There are medications that are through the IV. They are medications that are injected into your muscle or under your skin. There are medications that you use transvaginally or transrectally, or you might inhale some medications. All of those differences in the mechanism of taking the medication affect its bioavailability. For instance, if you have a medication that's injected right into your veins, that's 100% bioavailable because all of the medication goes right where it needs to be. And then it gets distributed throughout your body. But when you ingest a pill or a capsule or a liquid, it starts to get broken down right away. And then it goes through the liver where the liver will start to break it down and metabolize it. And then it gets absorbed through your blood system. So that medication is less bioavailable than if it was injected right into your venous system. Now that we have that foundation down, let's consider alcohol. Now, the recommendations are that women can have 1 alcohol drink a day and men can have up to 2 alcohol drinks a day. And so this is really interesting to consider. So what happens when you are, say, a woman and you are taking a drink of alcohol, it enters into your stomach. And women, we know, have slower gastric emptying times, right? Food and alcohol and medication stay in the stomach longer than they do in a man's stomach. Then they have slower gastric emptying time, so it takes it slower to even pass through all of your intestines. Then it gets absorbed to the liver, where the liver starts to break it down, and then it gets absorbed throughout your bloodstream. Now, when you consider the differences between that and men drinking alcohol, what happens is when men drink alcohol and they swallow it and it enters into their stomach, they have the enzyme that breaks down alcohol in their stomach lining, where women do not. So what happens is before it goes to the liver and gets absorbed in the bloodstream, it actually gets broken down right away. So that's why men can drink more without having that foggy sense. Women will have a sense of having this rush of alcohol because it's not metabolized as quickly as it is in men. So women have much more side effects with alcohol. They have greater impairment from it, and they can have greater effects of long-term use of alcohol to an extent that men do not. A really prime example is with the drug Ambien, also known as Zolpidem. This is a sleep aid drug, and it's been on the market for over 20 years. The original studies were, of course, like I mentioned, done in men. And of course, who's prescribed sleep medications more, men or women? It's women. Because women are just diagnosed with sleep disorder more commonly, plus they go to the doctor and get this diagnosis. So then they're prescribed this medication. And what's happened is all we have is that post-market surveillance for women because women were not part of the studies. It wasn't analyzed to see how women would metabolize Ambien uniquely and different from men. So women were prescribed the initial starting dose, and they would wake up in the morning with still grogginess, and they would get into their car and have impaired driving. and get into actually motor vehicle crashes, which for me as an emergency medicine physician is not a joke. It is life or death. And so this is a critically important component. So what happened is physicians and patients and pharmacists are all able to go online and put a report in. So you should also feel empowered that if you have a negative reaction or a concerning reaction or an unanticipated reaction to a medication, you can go right online on the FDA website and send that report in. What happens is they start to look at patterns. And they started seeing these patterns with all of these reports about women taking Ambien and then waking up impaired and then getting into motor vehicle crashes. So that forced a really good look into this medication. And they discovered that when you give a formulation of zolpidem, Ambien, to both men and women, the same dose, then by the time the morning comes, say you wait 6 to 8 hours, they were able to check the serum concentration of that drug between men and women. And women still had 2 times the serum concentration compared to men. So they're given the same dose at the same time. And then 6 to 8 hours later, they take blood tests. They look at how much of the medication is still in there. And women had 2 times compared to men. So this was really an important moment in the history of our prescription drug management system because this was the first drug that the FDA put together a sex-specific dosing regimen.